we're going to be talking about speech and language disorders. I'm Darlene Rose, a certified and licensed speech and language pathologist. A speech pathologist is also known as a speech therapist, and they play a very vital role, often as part of a team working with a number of types of disabilities and disorders. We provide services in clinics, in rehabilitation centers, in hospitals, in universities, colleges, and also in private practice, as well as in schools. It's our role to identify, to evaluate, and to treat patients with speech problems, language problems, cognitive problems, as well as stuttering problems, voice problems, and swallowing problems. Today we will discuss various types of disorders with a goal not only of increasing your awareness of these problems, but also giving you some insights and some information as to how you as a caregiver can be helpful and supportive. It's estimated that 1 out of every 5 people in the United States has a speech, language, or hearing problem that impacts communication. And communication is vital to life. It connects us to what is most important, our families, our friends, our jobs, and our recreation. Your skill with patients will develop and improve with experience. You know, it's not always what we say, but how we say it that matters most. The term for this is nonverbal communication. Your tone of voice, your facial expressions, even the way you touch a patient, all communicates an honest sense of caring. There are some strategies that can be used to help you communicate more effectively with your patients. Look directly at the patient as you speak. Listen attentively. Ask relevant questions. And do not interrupt. The process of speaking itself is controlled through a speech center located in the front part of the brain. This center exists only in the human brain. When we speak, the sound of our own voice comes from the vibrations of our vocal cords. The voice originates in the larynx, or the voice box, which is the upper end of the air passage to the lungs, and is located in back of the Adam's apple. The larynx, in cooperation with the mouth, the throat, the windpipe, and lungs, work on the same principle as a pipe organ or an oboe. Through this system, vibration is set into place, which causes sound. Over 100 muscles are used in the saying of a single word. The speech and language process can break down, and it breaks down for many reasons. Common causes are brain injury, cerebral palsy, traumatic accidents, and stroke. Each year, 730,000 people have a new or a recurrent stroke. If the speech and language centers are impacted, as a result of the stroke, aphasia may result. Aphasia is a disorder that impairs one's ability to understand and or express language. There are 3 types of aphasia: expressive aphasia, receptive aphasia, and global aphasia, which involves both receptive and expressive aspects. Aphasia can range from being so severe that little or no speech is understood or spoken, to being so mild that the only difficulty may be in finding the right words to express yourself. If the left side of the brain is damaged, the right side of the body is paralyzed, and vice versa, because the nerves cross to the opposite side of the brain. In addition, speech is affected if the damage is on the left side of the brain in a right-handed person, or on the right side of the brain in a left-handed person. For example, I am a right-handed person. My speech would be affected if I had an injury on the left side of my brain. In addition to aphasia, there are many other causes of speech limitations. Some of these are the neurologically degenerative diseases, such as multiple sclerosis and Parkinson's. Also trauma, chemical abuse, and surgical procedures. An example of limitations to a patient with Parkinson's would be reduced vocal volume. Speech and language limitations can be very frustrating, not only for the patients, but for you as caregivers, as patients are limited often in their ability to make their wants and needs known. There is a variety of communication assistive devices. 3 examples include the sound level meter. The sound level meter displays the loudness level in decibels. The voice amplifier, which assists the hard of hearing. And communication boards. Communication boards have keywords and pictures which assist the patient in communicating. Some patients also use very special types of electronic devices. The following suggestions will help you as caregivers to communicate more effectively and to reduce frustration. Greet the patient politely. Make sure you have their full attention. Speak slowly and clearly. Use short, complete sentences. Use nonverbal cues as needed. Ask simple yes, no questions. Allow adequate time for response. Provide missing words if necessary. Maintain a positive attitude toward communication efforts. Become familiar with communication devices. Praise all attempts at communication. Make sure that hearing aids and eyeglasses are used if needed. And do not treat your patient like a child. Remember, it's the disorder causing the communication problem. Such techniques will also be helpful in your work with other types of patients, such as dementia, learning disabilities, or other communication problems. Speech pathologists also work with swallowing problems, or dysphagia, which you may also hear pronounced dysphagia. The swallowing problems may be mild, or they may be so severe that a person is not able to take in any nourishment by mouth and must be fed by another means. When a person has a swallowing disorder, there is always the danger that the food or liquid will go into the lungs rather than into the stomach. This is called aspiration. Aspiration pneumonia may result. Signs and symptoms of dysphagia to be aware of are as follows. Excessive mouth movements during chewing and swallowing. Difficulty in starting a swallow. Coughing or choking while eating or drinking. Needing to swallow 2 to 3 times. Refusing to eat, spitting out food, or pocketing food in cheeks. Difficulty handling secretions or handling liquids. A wet, gurgly voice. The feeling that food is sticking and not going down properly. Unintentional weight loss. Or increased body temperature of unknown cause, which might suggest aspiration pneumonia. Report to the nurse if you note any of these signs or symptoms. A video swallow study is oftentimes required in order to determine the extent of a swallowing problem, as well as to determine the appropriate types of foods and liquids which would be safe for the patient. A swallow study is a type of X-ray, and it reveals any abnormalities in the swallow. Prescribed diets may be a general diet, a mechanical soft diet, which is similar to a general diet except that the meats are chopped, and a pureed diet. Liquids may need to be thickened in order to ensure safety. And by thickening the liquids, there is improved control and slower passage of the liquid. Liquids may need to be thickened to nectar consistency, honey consistency, or the thickest of all, pudding consistency. Many liquids today which are thickened are pre-mixed. However, water, tea, coffee, soda may require the addition of a thickener to take it to prescribed thickness. Many patients are placed on very specific swallow guidelines which must be carefully followed by caregivers in order to prevent aspiration. This is an example of a swallow guideline. A swallow guideline will indicate the specific diet that the patient is on, medications and how they can most safely be administered, the amount of supervision and setup that is required for the patient, positioning, generally upright and at a 90-degree angle, solids and how they can best be taken, small bites, 1/2 to 3/4 teaspoon, sometimes alternating liquids and solids is recommended, or a double swallow. Liquids, how they can best be taken, oftentimes small sips by cup or glass, and an indication as to whether a straw is safe. Recommendations are also listed as to whether a patient should remain upright after a meal. Oftentimes from 50 to 30 minutes they must remain upright after a meal in order to ensure proper digestion. If you have any questions regarding these swallow guidelines, please contact nursing or the speech pathology department. In conclusion, your role as a caregiver is a vital one. It is filled with challenges and opportunities. Opportunities to improve the quality of the lives of the patients we serve.